So everyone here is probably familiar with systematic reviews of etiology and risk and what etiology is and what risk factors are. But just in case, etiology refers to the study of the causes or origins of health conditions within a population, helping us to understand why and how certain health conditions develop. And similar to this concept is risk factors, which involves identifying factors that increase or decrease the likelihood of developing a particular health condition or progression of a disease. So while etiology explores the deeper understanding of causes and mechanisms of disease, risk factors help in identifying and addressing specific factors that contribute to the elevated or decreased risk of disease occurrence. So now I've used the word disease here, but we can really be talking about well-being or any other health outcome. And risk factors can be protective or detrimental. They're not always bad. And this is the intervention exposure continuum that I've adapted from Julian Higgins. And at one end, we have interventions that are modifiable and that we usually associate with trials. And at the other end, we have traits that are generally non-modifiable. And between these two parameters, there are actions we can consider, sometimes as an exposure and sometimes as an intervention. So for example, exercise can be considered an environmental or occupational exposure or a lifestyle behavior. It's what people are choosing to do. And we can also consider this as an intervention, so it's what we give people. And so the middle area on the continuum is kind of a transition zone where we have both the exposures and the continuums, and the different levels of how modifiable they are. So the types of exposure we primarily address in etiology and risk research are environmental and occupational types of exposures. And this is pretty much what we do and what is around us. And so this is the things that people experience that they may have some control over and are therefore modifiable. And so because these are modifiable, they raise a lot of issues, particularly in systematic reviews. So some of the challenges with exposure research is defining the exposure, because unlike interventions, it's very difficult to define when they start, their change over time, frequency, compliance, period of exposure. And so these are very much what we call unstandardized exposure measurements. Another of the key aspects of systematic reviews of etiology and risk is that most of the time we're combining exposures that come from different types of observational study design. So this is your cohort, case control, and analytic cross-sectional study designs. And this compounds the issue of unstandardized exposures and introduces methodological differences between your studies. And so we have this clinical and methodological diversity, and it becomes very difficult to combine this type of data in your systematic review.